35-year-old Maria Linda thinks that her nose is unattractive.
If I turn my face to the side, the first thing I notice is my big nose. It's got that bump, it's quite long. I notice that my nostrils are even long. What bothers me the most about it is it's totally unproportioned to my face and my size. Basically, when I'm getting dressed or I'm getting ready, what I'm trying to accomplish is to not make it stand out so much. Maybe something that's going to hide it a little bit more, be it a different hairstyle or, a hat where the focus is going to be somewhere else other than my nose.
Now Maria Linda is undergoing surgery to reshape her nose.
And I don't want a totally different face because it's evident our nose is in the middle of our face, and if that was drastically changed, I would drastically look different, and I don't want to look drastically different. I'm looking for my nose just smaller.
Maria Linda thinks her nose dominates her face, so she's undergoing surgery to change its size and shape.
Rhinoplasty is something that I've always wanted to do. I probably wanted to do it as young as I can remember, maybe in my late teens. Then life just goes on and you go to school, get married, whatever, and you tend to forget about all those things, and that's what I did. I kind of forgot about myself and what I really wanted for myself. And now having been divorced and I'm living my own life and being 35 years old, it's time.
I don't think that Maria Linda needs a nose job. When I look at her, I don't see her nose as a flaw that needs to be corrected in order to make her beautiful, because I think she's beautiful already. But I think that if the nose job is important to her, moving forward from her divorce, then I think she should do it.
I have found myself again, my true self, and this is something that I've wanted to do, and I'm going to do it now. This is the time for me.
Dr. Philip Solomon is a facial plastic surgeon practicing in Toronto. He'll be preparing Maria Linda today for surgery to reshape her nose.
Maria, how are you? So when I look at your nose, what I see is the nose is a little bit over-projected and stands out a little bit far from the face. So if you were to measure the distance from the cheek out to the tip, that's slightly excessive. It's got a bump on the bridge, which has some irregularities to it. The bone's just a little bit wide on each side where the cheek and the nose meet. What I would propose we do is try to set the tip back slightly, take some of the bridge down, narrow the bones, and at the same time do the work internally.
I just want a smaller version of what I have, if possible, with the extra little things that we can straighten out, but I don't want, somebody else's nose.
Okay, good. Well, it sounds like we're on the same wavelength then.
I just want to be able to look in the mirror, and if I'm turning to the side, I don't notice my nose. I wanted to do this surgery for a really long time. I guess I really never had the guts to do it, and finally, I'm definitely going through with it today.
Dr. Solomon begins by separating tissue from the nose's bone and cartilage. He then removes fat and cartilage from each side of the tip of Maria Linda's nose to shorten it. Additional cartilage and bone is removed from the bridge to reshape it. And the bridge is filed to give it a smooth appearance.
It's very light.
Finally, Dr. Solomon breaks bones and repositions them to straighten Maria Linda's nose. Maria Linda's nose reshaping surgery took 2 hours to complete. Is Dr. Solomon happy with the result?
The surgery went as planned. Technically it was straightforward, but she had somewhat difficult anatomy to work with, but I think everything went fine.
It will be 6 months before Maria Linda's swelling subsides, and she sees the full result of her nose reshaping surgery. It's been 6 months since Maria Linda underwent nose reshaping surgery. Maria Linda's nose is now smaller. The tip of her nose is shorter. And Maria Linda's bridge is straighter.
I am very satisfied with the results of the surgery. I think it was fantastic and I'm very content. When I look at my side profile now in the mirror, I don't see that big nose. I see something that belongs to my face. I can put my hair up, I can wear a hat, and I don't worry about, oh, how's it gonna look today? And I feel great when I go out. The recovery process was not that bad as much as I thought it was gonna be. I wasn't a walk in the park. 2 or 3 weeks of a little bit of discomfort, a little bit of swelling, a little bit of, dry blood, but other than that, it was not that bad.
Has plastic surgery set Maria Linda free?
Prior to the surgery, I was always thinking about my nose and how it looked. And now, having done it, it's absolutely what I thought it was going to be. It's an absolute sense of freedom for me. It feels so much better. It belongs on my face. My face is small, my features are small, and now my nose, it's not a tiny, tiny nose, but it's much smaller than it was, and it feels so much better. I'm so happy that I went through with it.